Hi, my name is Deborah Santos, and I'm a student nurse at Cedar Crest College. To begin, I will share my PICO question for my evidence-based poster. The PICO question is, in hospitalized patients, how does the practice of hand hygiene compared with not practicing hand hygiene decrease the risk of hospital-acquired infections? Hand hygiene is the most simplest and most effective way to reduce hospital-acquired infections. Throughout various studies and statistics, it shows how implementing strict observations and constant teaching dramatically decreases hospital-acquired infections. In the U.S., about 2.5 million hospital-acquired infections arise yearly and are correlated with 90,000 preventable deaths, with a yearly financial cost exceeding $4.5 billion. Sicker-Bennett et al. Presents a problem associated with this phenomena that healthcare settings fall short in achieving and sustaining healthcare compliance amongst healthcare personnel who interact with patients and their environment. Another problem that Fox et al. Addresses is that critically ill patients are at increased risk for acquiring hospital-acquired infections, and that in turn increases their risk of morbidity and mortality. A third problem is that healthcare workers' hand hygiene compliance continues to decline despite the efforts that they put to increase it, to make it successful. The process of literature, I went to the research librarian. She then informed me how to condense my search so I can find the exact articles that answer my PICO question. And because of her, I used EBSCOhost, which introduced me to CINAHL, Medline, and CINAHL. CINAHL is a more nursing database, and Medline is more of a medical base database, and sometimes that has like nursing journals and stuff like that in it, but CINAHL is more of a place where you would want to go. Keywords that I used was hand hygiene, hospital-acquired infections, and healthcare workers hand hygiene compliance. And limitations for this, I used from the years of January 2011 to something that the research librarian recommended, January of 2020, because sometimes there's newer articles that come out. And I chose 6 articles for this evidence-based paper, and I chose the 3 best articles that address my PICO question. So the first article for my evidence-based summary is Sicker-Bennett et al. And they examined whether the enhancement in the standard 80%, high standard 8% hand hygiene compliance could be increased to a 95%, which is a even higher hand hygiene compliance, to decrease hospital-acquired infections. And this was a longitudinal analysis during 2013 and 2015. Kirkland et al. Made a study to reduce hospital-acquired infections and improve healthcare workers' hand hygiene compliance. And this was a 3-year interrupted series with multiple sequential interventions and a 1-year follow-up intervention. Fox et al. Made a study to investigate new patient hand hygiene protocol to reduce hospital-acquired infection rates and to improve the nurses' hand washing compliance in the ICU. And this was a pre-experimental study. First recommendation is to demonstrate the importance of continuously improving hand hygiene compliance and how it is critical for hospital personnel who underestimate the value that it has on decreasing hospital-acquired infections. Fox et al. Also recommended that chlorhexidine gluconate baths reduce hospital-acquired infections. However, chlorhexidine gluconate resistance should be examined for future study investigations. Also, Kirkland et al. made a recommendation that simply informing healthcare personnel about the importance of hand hygiene and how that could decrease hospital acquired infections. And by doing this, you can do in services every so often, like monthly or whatnot, to reduce hospital acquired infections. And in conclusion, improved hand hygiene adherence amongst healthcare workers proved success in decreasing hospital acquired infections. Effective nursing informatics adds evidence to a significant improvement in hand hygiene and in turn decrease hospital acquired infections. Thank you.